This segment is brought to you by Cardiovascular Institute of the South, providing our patients the highest quality cardiovascular care available. And welcome back to Bayou Time. I'm Martin False, and always glad to bring you some groundbreaking medical procedures going on right here in the area. And Dr. Matthew Finn is with us today. And if you have, we'll call it uncontrolled high blood pressure, listen carefully. I'm not sure if all of you will fit into this, but we're going to ask the doc to explain this because, once again, Cardiovascular Institute of the South and Terrebonne General on the forefront of, using something called, I guess, Symplicity, Spyral, Renal, Denervation system. Don't say that real quick, right?
Yeah.
RDN.
RDN.
Because first of all, welcome aboard. Good to see you.
Thanks for having me back.
And thank you for coming. I know you're busy, but explain what I just said to the public, because this is very interesting.
Yeah, so it is very interesting, very exciting, and very different. A lot of people may not have heard about it yet. Basically, the concept is for really two groups of patients. One group is for patients with high blood pressure who may just have slightly high blood pressure, who can't tolerate being on blood pressure medicines either due to side effects or allergies, or just don't want to take blood pressure medicines. This procedure may be an option to get you off of blood pressure medicine altogether. The second group is those who are on multiple medicines and we just can't seem to control your blood pressure. It's an option to help get you off to usually around 2 blood pressure medicines lower than what you may be taking.
Yeah, no, in talking to friends, the older we get, most of our conversations at the dinner table now are, man, how's your blood pressure? How's this? How's your blood sugars? Let me ask you, so a lot of people, I hear quite a bit, can't handle beta blockers and different things. And so this device that you brought in, it looks pretty high tech, but exactly what do y'all do in this procedure?
So what we do is we find the kidney artery. First, we rule out a blockage in the artery. Then we take the catheter, we take a wire, put it down into the kidney, take pictures, make sure there's no problems, and then basically put the catheter in. And I have one here. I'll hold it up. Mm-hmm. It's a very tiny catheter called the Spyral catheter, and it goes on a 0.14-inch wire, which is very small. Yeah. It has electrodes, which we apply thermal heat energy to do radio frequency ablation to the nerves around the kidney. Mm-hmm. And that produces the hormone production from those nerves that causes the high blood pressure.
So, and it's interesting that the kidneys could cause high blood pressure, but so is the ablation a permanent thing or is it a temporary thing? And what it does, it stops the signals, I guess, to the heart to sort of slow down a little bit?
Not so much slow down, but just reduce the overall squeeze and vascular tension. Okay. So it stops the hormones that are produced by the kidney arteries. These arteries are many places throughout the body, but they have a very high concentration around the kidney arteries. That's why we target that area with the procedure.
Now, knowing back surgeries and all, when they do ablations or whatever, sometimes the nerves can grow back. Is that similar in the kidneys, or is it one and done, or you may have to go in for more than one?
The idea is one and done. We haven't seen a significant need in the studies to go back and do repeat treatments as long as you get a good ablation on the first time through. And we take a lot of time and effort to make sure we treat all areas we can with the catheter.
This is just another amazing thing. I've been covering CIS and Terrebonne General for over 40 years, and it seems like every few months there's a new technology. And you're a young doctor, and you're coming on, and y'all got all these great tools to work with. So how does it, I mean, that's probably feels pretty good because y'all used to video games and everything else. That's pretty common for y'all today, isn't it?
Yeah, it's very exciting. And one of our core pillars that Dr. Walker wrote when we defined our mission statement for CIS is to be leaders in technology. So we're always trying to stay up to date, enrolling in people and trials, getting new technologies such as this one. And we also have an ongoing trial with a similar device this is specifically targeting those patients in the first category we talked about who may not be able to tolerate any blood pressures, blood pressure medicines want to come off completely. So if you're interested, we do have an ongoing clinical trial for that, so you can reach out to CIS to see if you'd be a candidate.
And what I want to tell the audience too is to stick around, because in segment 2, we talked a little bit about the procedure and all, but there's going to be a lot of people looking at go, well, wait, I have a variation of that, or I have a little thing. So maybe we can explain who are the candidates that we're looking for. Maybe it's A to Z, or maybe it's A to B. We don't know yet, but I'm going to let you answer that question. So what I'll do now, take a break. When we come back, we'll let you explain all that. All right?
Thank you. Thank you,
All right,
Martin.
we'll take a short break. We'll be right back. Are you a candidate for this procedure? Stick around. This segment was brought to you by Terrebonne General Health System. Your partner is good health. All right, welcome back. Some great medical news happening here. Dr. Matthew Finn is with us from Cardiovascular Institute of the South. And this was what do we call it, a procedure?
Yes.
Approved by the FDA in November of 2023. Medtronic Symplicity Spyral Renal Denervation System, better known as RDN, is a minimally invasive treatment for people whose high blood pressure stays too high even after lifestyle changes and medication. So, with that said, who qualifies? That'd be probably a long answer.
Yeah, so people come to me all the time and they say, I have high blood pressure, but that's just where I run. High blood pressure, we typically think of as being a blood pressure being greater than 140/90. That turns out that's actually stage 2 hypertension. So that's the point where we're going to want to be a little bit more aggressive when you're 140/90. And I have a little issue with the statement, that's just where I run. I find that us as doctors aren't doing a good enough job if we can't get it below that point, because the blood pressure can do damage to the, brain, causing increased risk of stroke, the heart, increased risk of heart attack, or a weak heart potentially, and very importantly, the kidneys themselves can get damaged by high blood pressure. So more and more evidence is coming out that we should get the blood pressure lower and lower, and this new tool is an important way to do that. Before we would want to do the procedure, there's a couple important things that we need to evaluate patients for that basically we're looking for reversible causes of high blood pressure. Is there a medicine you're on that's causing your blood pressure to be too high? Very common is the NSAIDs, the non-steroidal anti-inflammatories. Can make the blood pressure go high, so we'll try weaning those off. We're going to want to check your kidney arteries, make sure there's no blockages. We're going to make sure you've had sleep apnea testing, things like this. We want to look at your diet, make sure you're not eating too much salt in your diet, all the simple things that we could do to try to get the blood pressure down before turning to an invasive procedure. But it is a good option once these other things are addressed or fail.
Now, when you're talking about blood pressure, Doc, are you but people watching, some may have had a gradual increase in blood pressure. Some may increase just sporadically. And maybe it just happened overnight or something. Does this procedure help all of those?
It can help everyone. If it's a very abrupt change in blood pressure, I usually like to follow it over time before I would want to do something invasive. Sometimes just, if you eat a whole lot of salt or you have a medicine interaction or some super stressful event in your life, it can really drive the blood pressure up. And doing an invasive procedure there might not be what we want to do. But for patients where it gets high or we can't control it, then I'm certainly thinking this may be a good option for that patient subset.
And probably in doing shows here for over 40 years, I would think the most talk that I hear a lot about is blood pressure. I mean, you hear people talking about other things. They may have broke their hip, they may have need a knee replacement, this and that, but the most common conversation we always hear is blood pressure. Is that the same in your realm?
Well, I think it's extremely common and extremely important to talk about. And the important thing to recognize with blood pressure is patients frequently don't feel bad. They may have high blood pressure and they may not feel anything. It's very what we call insidious, meaning it can do damage without you knowing it. So that's why we are always so focused on it at our visits, trying to get it down, trying to get a sense of where it is at home. We have to put you through, getting a blood pressure log and keeping them at home so we get a sense of where they are at home. We also have programs at CIS where we provide you a blood pressure cuff, and it transmits it electronically to me or the other providers in our practice, so we can continuously follow it. And that comes with a nurse that's checking it as well and notifying us if it's out of range on a couple of readings. So that's a nice option that we have to more closely follow people's blood pressure. But yes, it's very common in the discourse, and I think it really needs to be because it's up there with the top 3 most common risk factors in addition to diabetes and smoking.
Let me ask you, this device you have on the desk right here, when they go in and they qualify for that, is that an outpatient procedure?
Yes. Right now we are doing it in the hospital at Terrebonne General, but it's a same-day procedure. The procedure itself takes about an hour. We're going through the artery in the leg, the femoral artery, find the kidney, take pictures, and then place the catheter and treat both kidneys, and then we're done.
When you've done this procedure, do people come up to you the next day and go, wow, I feel much better? What's their reaction to it?
So it is a more gradual decrease than you might expect. It's not instantaneous. We find that the majority of the results take 2 to 3 months to see. And that's because the hormones in your body get down-regulated over time that are produced by the nervous system. So it does take some time. And usually we don't change people's blood pressure medicine right away. We wait, and then in clinic, we slowly taper it down. And on average, patients can reduce their blood pressure medicines by 2. And then the average blood pressure drop is around 8.5 to 10 millimeters of mercury.
Okay, that's significant. So this has to excites people watching as patients, but as a doctor, I'm sure this excites you too.
Yes, I think it's really important, especially for those patients out there who we just feel like we can't get their blood pressure under control. The patient may be getting frustrated. The doctor even may be getting frustrated. We've got you on 5, 6 medicines. It's totally overwhelming. This is a great option on reducing that number of medicines, reducing the confusion for the patient, reducing the amount of medication side effects and interactions that can happen. So that's what's particularly exciting about it.
Congratulations again. I've often said it for many years. I've been talking about innovations, and yet another young doctor comes on board. We're talking about innovations, and hopefully I can do this a few more years and still talk about new innovations. Good seeing you again. I've heard a lot of good things about you, and I appreciate you coming by.
Yeah, thanks so much for having me back.
All right. Dr. Finn once again at CIS. If you qualify, give him a call, make an appointment. We'll be back with more. Don't go away. This segment was brought to you by Cardiovascular Institute of the South, providing our patients the highest quality cardiovascular care available.